Meanwhile, medical practitioners are urging COVID-19 survivors who have identified changes in their bodily functions or any post-COVID symptoms to immediately seek medical attention to remedy the situation. This follows recent research on the effect COVID has on patients. Seizures, mental health issues, infertility, and erectile dysfunction are some of the findings. Dr. Justice Yankson, speaking on Joy FM's Super Morning Show, stated even though reports are not conclusive, damage caused to the testicular cells by COVID-19 through hyperinflammation of the cell tissues may affect male fertility in the long run.
Post your recovery, like you described, you're testing negative, you're being discharged from the hospital and what have you. There are residual problems or complications that these patients will have to grapple with, especially those who get moderate, severe critical illness. And then even those with mild conditions who have been treated at home and all that, they also can get these problems post their recovery. And the problems cut across all organs. You may not have all, but you could have a combination. It could be 2, 3 different systems or organs involved. It could be just one for you. But the long and short of it is that post-COVID problems are there. Let me just mention a few of the things we see, and then we'll zoom in on why ED or erectile dysfunction in particular. You can have situations where these people will keep having the problems, and sometimes they've been described as the long haulers. For 100 days, for 6 months, they still have problems. So fatigue, things like muscle weakness, difficulty breathing, difficulty sleeping, hair loss, loss of smell, taste, problems with, say, their mobility, issues around, let's say, mental health, depression, anxiety, some neurocognitive, disorders. So somebody, for example, like the sort of things you may see in somebody with, say, dementia, those ones are described as neurocognitive. So maybe loss of memory, stuff like that. Their affect is affected. Some are beginning to get seizures and what have you. It's all because of the problems that COVID has created. And a lot of it is as a result of what we call the hyperinflammation that occurs when COVID-19 is at play. And that results in all these residual issues.
So are there some people who are more susceptible to these post-COVID effects, like maybe older people or people with particular pre-existing conditions or people in a certain part of the world? Who is most likely to end up with, erectile dysfunction or any of the other post-COVID symptoms?
Well, the truth is that the research is still ongoing, but the figures show that generally, like I said, those who get severe critical illnesses, those with moderate disease, tend to have these things the more. But of course, even those with a milder form, they also get. What we have also seen is that those who have some general, let's say, disease burden, poor health, generally, may also come up with these things. But the long and short of it is that all these things we have described, the hyperinflammation and what have you, the blood clotting and all the bits, results in a situation where you have damage to the vessels. The middle organ is such that it is blood that is pumped into it for the erection to be sustained or for you to see that, yes, it has grown inside. It's a spongy tissue. So as and when it has to erect, blood is pushed in. Now, some of these blood vessels that go in there to supply, and then those within the organ themselves, the organ itself, are destroyed by the COVID disease through the hyperinflammation activities that we are talking about. So the linings are destroyed, some are blocked, some clots may also form. So once you have this damage to the vessels, then you can have this problem.
Can it be fixed? Can such damage be fixed?
Hello?
Sorry, I was just wondering, can such damage be repaired?
Well, you may have to see a urologist for assessment. So probably, if you give me a bit of time, we'll get to that bit in no time.